Hello everyone! Welcome back to my YouTube channel. By the way, this is Anna Lexine. If you're new to my channel, gumagawa po ako ng mga videos na patungkol sa gamot. Okay, hindi po ako doktor, so please don't call me doctor, but I am a pharmacist and tungkulin ng isang pharmacist na ipaintindi sa mga pasyente kung paano nga ba ginagamit ng maayos yung mga gamot na nireseta sa kanila ng doktor. Ano nga ba yung mga dapat na alalahanin kapag sila ay nagtitake ng isang particular na gamot? Paano nga ba ito appropriately na ititake at ano nga ba yung mga bagay na kailangan nilang tatandaan kapag sila ay umiinom ng mga gamot na to. Okay, so sa araw na to, tayo po ay mag-uusap tungkol sa hypertension. So if excited ka na, ina-invite kita na i-click yung bell button at saka mag-subscribe sa aking YouTube channel. Okay, so without any further ado, let's get started. Okay, so let's define what is hypertension muna, no? Now, this is according to the mayoclinic.com and it says here, hypertension or high blood pressure, it's a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart diseases. Now, ang blood pressure reading natin, it is given in units of millimeters per mercury. And ang kanyang nire-read is yung dalawang blood pressure units natin. And that is yung top number, that is the systolic pressure, and then yung diastolic pressure. Now, ang blood pressure, according to the JNC7, okay, siya ay naka-classify into different types of hypertension. So, ilalagay ko na lang sa ating screen. So, makikita natin dyan, ang normal blood pressure daw, according to the JNC7, is 120/80 or less than. Okay? Pagka ikaw daw ay merong 120 to 139 systolic blood pressure and a diastolic blood pressure of 80 to 89, you have a pre-hypertension na tinatawag natin. And then yung stage 1 hypertension is if you have systolic of 140 to 159 and then 90 to 99 na diastolic blood pressure. Ibig sabihin nun, yung blood pressure mo is nasa stage 1. And then yung stage 2 is kapag meron kang blood pressure reading consecutively, 2 consecutive readings of more than 160 to systolic blood pressure and also a diastolic blood pressure of more than 100. Okay? Now, yung classifications na yan ng blood pressure is according siya sa JNC7. Okay? Now, ang blood pressure kasi, pwede siyang existing even without any symptoms. Okay? So, pwedeng you feel great, you feel awesome, ganyan, wala kang nararamdamang ibang simptomas, pero yun pala, mataas na pala yung blood pressure mo. Okay? And sometimes, this uncontrolled high blood pressure, it may increase your risk to serious health problems such as biglang naha-heart attack o biglang na-stroke ang isang pasyente. Okay? Kasi nga, yun yung nakakatakot sa high blood pressure or hypertension. Hindi mo ma-feel yung symptoms unless sobrang severe na siya. And which is why it is recommended na lagi tayo mag-consult sa ating mga doktor, magpa-executive check-up tayo once a year or every 6 months para makita natin kung how is our body doing, are we still healthy or hindi na pala tayo healthy, parang ganyan. Okay, so ngayon, let's proceed naman sa ating what are the possible causes? Bakit kaya ang isang tao nagkakaroon ng hypertension? Okay, so next is what are the possible causes of hypertension? Okay, saan nga ba natin siya nakukuha? Ano nga ba yung mga iba't ibang kondisyon na pwedeng mag-lead sa hypertension? Now, this is again according to the mayoclinic.com. So, number 1 is yung tinatawag natin na primary hypertension or essential hypertension. Now, in this case, there are no specific conditions or specific causes, no? This is a kind of hypertension that just tends to happen over the years. Kumbaga, bigla na lang siyang nagkaroon ng hypertension nang wala namang ibang causes. That is the number 1 reason kung bakit nagkakaroon ng hypertension. 'Di ba parang nakakagulat. Number 2 is this might be caused by secondary hypertension. Ano nga ba yung secondary hypertension? Now, this is a kind of a condition whereby the high blood pressure is caused by any other underlying conditions tulad na lamang ng adrenal gland tumors Okay? Merong adrenal gland tumor yung pasyente, kaya siya nagkaroon ng high blood pressure. Ano pa? Thyroid problems. Okay? Or baka naman siya ay pinanganak ng merong congenital disorders sa kanyang blood vessels. Yes? Okay? Or yung mga tao na gumagamit ng mga ibang medications na merong risk sa pagkakaroon ng hypertension. Okay, tulad na lamang ng birth control pills, ng mga cold remedies, especially yung mga naglalaman ng phenylephrine at saka phenylpropanolamine. Yes. Okay, nagko-cause sila ng hypertension. Ano pa? Over-the-counter pain relievers and any other prescription drugs. Now, yung mga medications natin na ito, okay, like yung birth control pills, hindi ka agad-agad magkakaroon ng hypertension pagka ginamit mo siya. Okay, nagkakaroon ka lang ng hypertension sa paggamit ng mga ganitong medication, especially if you use this at really high doses or chronically. Okay, magiging at risk ka sa pagkakaroon ng hypertension. Ano pa? Yung paggamit ng mga illegal drugs katulad na lamang ng cocaine or shabu, kasi ang adverse effect nila is pwede niyang pataasin yung blood pressure mo at pwede rin niyang pataasin yung pwede din siya mag-cause ng tachycardia na tinatawag natin or yung pagtaas ng heart rate. Okay? Ano pa? Ikatlo, but this is not included in the mayoclinic.com, but there are some website na sinasabi na ang hypertension din daw ay induced by pregnancy. Okay, so that leads us to our number 3 point, and that is the pregnancy-induced hypertension. Ibig sabihin po nito, ito ay isang uri ng hypertension na nangyayari during pregnancy. So, especially sa mga babae na nabubuntis. Okay, so for example, yung nanay or yung isang bagong buntis or first time niya na nagbuntis siya, okay, before, nung hindi siya buntis, wala naman siya hypertension. Pero bakit ganon? Nung nabuntis siya, nagkaroon na siya ng hypertension. Nagkaroon ng irregularities yung kanyang blood pressure at tumaas pa siya lalo. So, yun yung mga possible causes ng hypertension natin. And, ito yung mga bagay na kinukonsidera din ng ating mga doktor bago sila mag-diagnose ng isang pasyente natin. So, may mga different symptoms na pwedeng maranasan ng isang tao na pwedeng mag-lead sa diagnosis ng high blood pressure siya or hypertension. Ngunit, hindi porket ganun yung naranasan ng kapitbahay mo na na-diagnose dati ng hypertension, ibig sabihin, ganun ka din dahil may nararanasan kang ganun. Okay, for example, sa kanya, nahihilo siya, nagsusuka, okay, tapos ikaw, nahilo ka at nagsuka, tapos nag-conclude ka din agad na meron kang hypertension. So, hindi po ganun na-diagnose ang hypertension. Okay, may mga iba't ibang test na nire-recommend ang mga doktor natin, physical test, mga laboratory test, okay, mga iba't ibang test para ma-diagnose nila ng maayos yung mga pasyente natin. Okay? Lalo na kayo kung meron kayong hypertension. Okay, ngayon, hindi tayo masyadong magpo-focus dun sa diagnosis. We will just have to leave it to the doctors. Okay, ngayon, pumunta naman na tayo sa medication. Okay, dahil bilang isang pharmacist, mas confident din akong i-share sa inyo yung medication na tinatawag natin. So, yung type ng medication na piniprescribe ng mga doktor natin sa mga tao na na-diagnose na merong hypertension is depende po yun sa sa blood pressure measurements and yung overall health ng isang pasyente. Okay? So, kumbaga, iba-iba yung approach ng mga doktor natin. Depende doon sa overall health ng isang pasyente. Okay? Kaya nga meron tayong tinatawag na therapeutic goal or treatment goals, okay? So sa pagdi-treat ng isang or sa pagme-maintain ng blood pressure ng isang pasyente, meron tayong tinatawag na treatment goals or therapeutic goals. Ibig sabihin nito, depende, yung gamot na ibibigay sa'yo ng doktor ay depende sa overall health mo. Kung ikaw ba ay merong hypertension who is at the same time na diagnose na meron kang kidney disease, meron kang diabetes, or meron kang coronary artery disease. Yan, depende po, okay? Pero, pag-uusapan natin yung mga medication, okay? Ipapaintindi natin ngayon kung para saan nga ba ito, paano nga ba siya nakakatulong na ma-maintain yung blood pressure ng isang pasyente. Okay, so number 1 is yung tinatawag natin na diuretics. Okay, so what are diuretics? These are kinds of agents that induces diuresis, or ibig sabihin, it will try to eliminate, it will try to help your kidney to eliminate excessive sodium and water content into your body. Now, diuretics are divided into different categories. So we have the thiazides. Example dun sa thiazide natin is yung hydrochlorothiazide na tinatawag. And then for loop diuretics, we have a lot, pero ang pinaka-common sa ating mga community pharmacy is yung furosemide. Okay, and then number 3 is yung potassium-sparing diuretics. Katulad na lang ng spironolactone, triamterene, eplerenone. So, itong mga diuretics po na ito, pinipili ito ng doktor natin. So, ang nire-recommenda niya is depende doon sa blood pressure measurement mo at kung depende doon sa kakayanan ng kidney mo. O depende rin siya doon sa condition mo, kung meron ka bang kidney failure, kung meron ka din ba at the same time heart failure, ganyan. Okay, so yung mga ibang diuretics natin, hindi lang sodium ang kanilang ini-eliminate or ini-excrete, pero pati potassium. And we all know na there's a high chance na pagka na-eliminate yung potassium natin is magkukause siya ng tinatawag natin na hypokalemia. Kaya nga, para ma-prevent yung mga ganitong cases ng hypokalemia, is ang binibigay ng doktor is yung yung potassium-sparing diuretics natin, para ang ilalabas lang niya is yung sodium at water, pero it will leave the potassium inside the body. And ang example ng gamot na yan is yung tinatawag natin na spironolactone, or yung kilala natin siya sa brand na aldactone, or yung triamterene natin. Okay, so basically, ang gamit ng diuretic is ilalabas niya yung sodium at yung water content sa ating katawan para ma-maintain yung blood pressure.
Rin pala guys, when it comes to the use of thiazides like hydrochlorothiazides or also chlorothiazide, it is recommended for the patient to have a sun protection. Bakit? Kasi yung mga thiazides natin, they will cause some skin irritations when someone who is taking a thiazide drug is under the sunlight or yung sun rays for a very long time. Minsan nagkukause siya ng skin irritation. Kaya nire-recommend natin sa mga tao na nagta-thiazide or nagtitake ng thiazide, prescribe ng thiazide, na they would have to put on some SPF lotion which will protect their skin against the sunlight, or might as well you have to use your long sleeves or jackets or umbrella kapag hindi talaga maiwasan para sa'yo ang mag-stay sa sunlight.
Okay, number 2 naman is yung tinatawag natin na ACE inhibitor, or also known as the angiotensin converting enzyme inhibitors. Ano nga ba yung ACE inhibitors? So, ano yung mechanism niya? Paano siya nakakagamot or nakakatulong na ma-maintain yung blood pressure ng isang pasyente? So, ang ACE, isa siyang angiotensin converting enzyme. Ito ay isang natural na chemical sa ating katawan na pagka ito ay excessive na na-produce or na-secrete sa ating katawan, pwede siyang mag-cause ng tinatawag natin na vasoconstriction. So, yung vasoconstriction, it's a condition na kung saan magiging makipot, okay, yung blood vessel. Kumbaga, kung ganito siya kaluwang yung blood vessel, dahil sa ACE is nagiging ganito na lang. So, syempre, iisipin natin, kapag ang dugo, okay, dadaloy siya sa blood vessel, tapos yung dadaanan niya is makipot, ibig sabihin, there's a high chance na pwedeng tumaas yung blood pressure. Okay? So, kailangan natin gawin dito is i-inhibit natin yung ACE na nagkukos ng pagkipot dun sa daluyan ng dugo natin, or nagpapakipot ng blood vessels natin. Okay? So, ibig sabihin, pag na-block natin or na-inhibit natin ang secretion ng ACE natin, is it will lead to the relaxation of the blood vessels. Okay? So, pagka na-relax ang blood vessels, yung dating masikip na daanan, luluwang yan, and then, that being said, it will lead to the relaxation, it will lead to a maintained blood pressure. Okay? So, ano nga ba yung mga gamot natin na naka-classify sa ACE inhibitor? Ito yung tinatawag natin ng mga prils. lahat sa kanila ay nag-e-end sa suffix na pril, such as captopril, we have lisinopril, we have kinalapril, perindopril. Yung perindopril, available yan as arginine and erbumin, yung mga ganyan. Okay, now what are the possible side effects of taking ACE inhibitors? Of course, number 1 is hindi siya pwede sa mga buntis. Okay, number 2 is it sometimes causes dry cough. Okay, so mapapansin ng mga ibang nagtitake ng ACE inhibitor, inuubo sila tapos wala namang plema. Possible yan na mangyari, but that doesn't happen all the time, only in some few patients. Okay, and then number 3 is it causes hyperkalemia or yung pagtaas ng potassium. Okay? Next is yung tinatawag naman natin na ARBs. Actually, yung ACE inhibitors and yung ARBs natin, parang almost the same yung kanilang mechanism or yung paraan kung paano sila nakakatulong sa ating katawan para ma-maintain yung blood pressure natin. Pero iba sila when it comes to the mechanism process. Okay, so yung ARBs natin, it's also known as the angiotensin 2 receptor blockers. Now, yung angiotensin 2 receptor natin, when this is stimulated, it will lead to the production of angiotensinogen. And yung angiotensinogen na tinatawag natin, isa din siyang natural chemical sa ating katawan na responsible sa pagdami ng volume ng sodium at water content sa ating katawan. So, chances are, pagka na-stimulate yung angiotensin 2 receptor, tataas din lalo yung sodium at yung water content sa katawan ng tao na pwedeng mag-lead sa high blood pressure. Ngayon, bakit natin kailangang i-block yung angiotensin 2 receptor? Para walang gagawa ng angiotensinogen at walang mapuproduce na excessive water and sodium sa ating katawan. So, chances are, it will lead to the relaxation again of the blood vessel. So, di ba parang it's almost the same doon sa mechanism ng ACE natin. However, ang pinagkaiba ng ARBs is hindi siya nagkukos ng dry cough. Kaya nga yung mga pasyente na nakaka-experience ng severe dry coughs sa paggamit ng ACE inhibitor is shift sila ng ating mga doktor. It's either sa mga ARBs or any other hypertension pills. Okay? And also, hindi din applicable or hindi din recommended ang ating mga ARBs sa mga pregnant patients natin. Doon sa ARBs pala, guys, what are the different drugs that fall or specific agents that falls under ARBs? Ito yung mga sartan na tinatawag natin. Okay, we have a lot of this in the community pharmacy. Pinakasikat yung losartan natin, diba? So, we have the losartan, we have the candesartan, telmisartan, valsartan. There are a lot of sartans, diba? Irbesartan, yung mga yan. Yung mga yan ay they are classified as ARBs or angiotensin 2 receptor blockers. And then number 4 is yung calcium channel blockers natin. Okay? Ngayon, ang mga calcium channel blockers natin is they work as an agent that will help relax the muscles of your blood vessels. Because why? We know that the calcium is responsible of muscle contraction. Okay? So, sa calcium channel natin, pagka ang calcium channel natin is open, magre-release yan ng so much calcium. Okay? So much calcium, it will lead to muscle contraction dun sa ating blood vessels. So, pagka nag-contract yan, ninipis ulit yung blood vessels natin. Ngayon, pagka nanipis yan, edi masikip yung daluyan ulit ng ating blood. Okay? Kaya natin siya binablock natin yung calcium channel is para wala na siyang ilabas na calcium and ma-relax ulit yung muscles ng ating blood vessels. Okay. Now, what are the specific agents that falls under calcium channel blockers? Sila naman yung tinatawag natin na dipins. Okay? Like felodipine, we have the amlodipine, nisoldipine, nifedipine. There are a lot of dipins. Okay? Now, what are the possible adverse effects or side effects ng paggamit ng mga calcium channel blockers? Okay? Pagka ikaw ay nagka-calcium channel blocker, hindi ka pwedeng uminom ng grapefruit juice. Okay? Kasi pwede nitong itaas lalo yung absorption ng calcium channels mo. Ano pa? May mga chances, especially when it comes to the use of amlodipine, may mga chances na nag-cause siya ng edema. So, if this happens, you have to contact your doctor and mag-ask ka to shift and mag-ask ka na i-shift yung gamot mo sa other blood pressure pills, okay? Kasi sa amlodipine, pwede siya mag-cause ng edema, pwede rin siya sometimes mag-cause ng irritations or pag-bulge or pagkate ng mouth area. But that doesn't happen to everyone, only to few people, okay? What else? Yung beta blockers na tinatawag natin. So, yung beta blockers natin, from the word itself, they block the beta receptors. So, sa atin kasing heart, meron tayo dyang dominant receptor and that is the beta 1. Okay? Yung beta 1 natin, kapag ka na stimulate yung beta 1 receptor sa ating puso, is magkukause siya ng tachycardia or yung pag-increase ng heart rate. It will also increase the blood pressure. Okay? So, ang gagawin natin is, pagka na-block yung beta 1 receptor, it will of course reduce the workload of the heart and pwede rin niyang i-widen yung blood vessels. That will lead to causing mas bababa yung heartbeat or magkukause ng bradycardia.
Ayan guys, so ang beta blockers po natin, they are not the first line agent, okay, when it comes to treating people with hypertension. Nagiging option lamang po ang beta blockers sa mga pasyente na may other underlying diseases or conditions, especially kapag ang pasyente meron siyang history ng stroke or meron siyang diabetes, meron siyang kidney failure, yung mga ganon, and at the same time meron ding hypertension. So those are kinds of considerations that will lead a prescriber to the use of a beta blockers. Yun nga guys, hindi siya ang laging first line agent, okay? So what are possible specific agents that falls under this classification? We have metoprolol, we have atenolol, carvedilol, nebivolol. Yung mga yan, yung mga nag-e-end sa ulol, they are known as beta blockers. And the way they act in our body, or their mechanism in helping our body when it comes to the maintenance of blood pressure, is that they block the beta 2 receptor, the beta 1 receptor, which is dominant receptor in our heart. And that being said, magkakaroon ng maintenance ng blood pressure. Ayun.
Okay, so I think dito na tayo magtatapos sa ating beta blockers. Oo, kasi these are the only common medications or treatments na piniprescribe ng ating mga doktor sa mga taong may hypertension. Again, everyone, or to my viewers, if you watch this video, this is not intended to be a platform for you to ask me anong ititake ko. Ako ay dating merong hypertension. So, hindi po ito tanungan ng mga medical advices. If you want to be more specific with your conditions, I prefer na lagi kayo mag-contact ng inyong medical doctor because they know what is best for you. And as pharmacists, we are only here to guide you on how you appropriately use your medications. Okay, so in any cases, if your symptoms persist prior to taking any of these drugs na nabanggit ko kanina, you have to contact your doctor or also your pharmacist. Okay, so I think that ends our video. Thank you so much for watching and see you soon sa ating susunod na episode. Bye!